Welcome to Mama Lume Health Talk platform. For today's edition, we'll be discussing the prevalence of teenage pregnancy in Liberia. This platform helps to discuss health-related matters that are things that are difficult for us to have in the country, and we have so many things or challenges. So this platform helps to build up issues, set situations, and discuss issues that is pertinent to us. It's health-related issues. Thanks to Mama Lomed for giving me a time and opportunity to see how we can discuss when it comes to teenage pregnancy in Liberia. Because of other circumstances, she was not able to be here, so I'm here in her place for today. Thanks also to the DJ Blue family for giving us the opportunity to come here. And to start with, as our studio guest is already here and prepared, so at the theme song, we also start the program. Welcome.
This is my song about with what you put in, you get out. You for welfare if you.
Welcome back to Mama Lume Health Talk platform. For today's edition, again, we will be discussing the prevalence of teenage pregnancy in Liberia. You are welcome to this health platform. We also talking to our viewers around the world. Welcome, and wherever you are, the times, whether it's in the evening or in the afternoon or in the morning, welcome to this health talk platform. So for today, just to give a gist of what we'll be discussing, we're talking about teenage pregnancy. We are talking about pregnancy that occur between the age of 15 to 19 years, before or 20 years. We are talking about it. And little statistics about it is that according to Plain Liberia, we have 7.3 million girls under 18 years give birth. Teenage pregnancy is a woman under 20 years who get pregnant, usually referred to as a teenage. So we know that this condition is not that easy. And the beginning of teenage pregnancy, according to history, it starts way back in the 50s, where the Norwegian girls were having intermarriage, and before the 70s they have whole lot of children before the age of 20. Now, to give us statistics, in Africa, nearly 25% of women have pregnant worldwide, and the prevalence of the pregnancy in Africa is about 18.8%, and 19% to the sub-Saharan, and 21% to East Africa. When we come down to our country, Liberia, it is an alarming rate of teenage pregnancy in Liberia. The estimated average is every 10 Liberian girls, you have 3 that will come down with pregnancy before 18. Just imagine that. And among adolescents, especially in the rural area, it doubled that figure. 24% in the urban and 42% in the in the rural area. So to see how how it is disturbing that our children or the teenagers are getting pregnant at the age of under 20. Now, for us to enter into our discussion today, we have our guest. He will introduce himself to the show.
So, first, let me appreciate you for having me on the program. This is a fascinating topic that should be discussed so that the information can be able to spread across the length and breadth of our country so as to give people the significance of some of these things that are affecting society on today. My name is Bazi Smo, who Associate of Science degree in nursing from the Smart City of Management Technology, and currently I'm a candidate of Bachelor of Science degree in nursing. I also serve as an assistant clinical chemistry lab instructor at the Smart City of Management Technology as well, and is the program director of a campus-based organization called Healthcare on the Wheel. They want to ensure that healthcare services can reach to people out there in society. And also, I form part of another organization called the Scholars Educational Network that is basically involved with working with young people. So thank you for having me.
Thank you very much. Through your CV and what you are doing, it shows that you should be on a show. And what about him again? He was a former student leader from the Smart University, and he deal with a whole lot of teenager, and especially when you're looking at him, he's a young man, and he actually can discuss the issue being around in the community, how teenagers actually they are reacting, what are some of the problems, what are some of the difficulties, what are consequences actually. So for today's health talk, we go into it. We need your view also too when it comes to this. Our audience, we need your view, we need your contribution, and whatever question that you want to ask our guest here, he's prepared to do that because he is experienced and he work with youth. And sorry, our other guest is not here because of circumstances that is beyond her control. But yet and still, we will start the ball rolling. So thank you ever so much, Mr. Smo, for.
Thank you.
Now to enter into our discussion, when we are talking about teenage pregnancy, what really comes into our mind?
When we talk about teenage pregnancy, basically from the denotative meaning, it has to do with pregnancy occurring before the age of 18 or 20. So from 10 up to 17 years old, if somebody gets pregnant, that has been classified, or up to 20 years old, if somebody gets pregnant, that has been classified as teenage pregnancy. And as you rightly said, there are other factors too that influence some of these things when it comes to teenage pregnancy, for which we will delve into as we go about having a conversation.
Thank you ever so much, for making our audience to have that clear view when it comes to teenage pregnancy. What is teen and what is teenage pregnancy? So to enter into that, what are some of the contributing factors that can lead to a teenage pregnancy?
There are several factors. Like from the inception of the program, you read a statistics, and as I was researching, what we found out is that bulk of these things are happening in third world country. That is to say, people that are being economically challenged, people that don't have the requisite funding. And this is not squarely associated only with the victim. That is to say, since in fact a young girl gets pregnant, it means that we should throw all of the blame on them. And this is a shared responsibility. So those things have been categorized into family, some of them community and culture, some of them the individual themselves. And considering when we talk about family being part or parcel of young girls getting pregnant at the teen age, one factor could be lack of positive family discussion, because in our country or in our region in Africa, or more especially Liberia, since we're talking about Liberia, to discuss sex education with young people is like a taboo. You don't necessarily open up to people to talk about sex education. People will somehow, they will resist you, and sometimes they will chastise you for that, because they feel that when you're discussing sex with the children, automatically you are encouraging them to go and get involved with sexual intercourse. That's just one. Besides that, when it comes to the economic standpoint, because we've been economically challenged, there is no funding. In other words, we are very poor in Liberia. So many a time, young girls or teens have to get involved with uh, sex work. That is to say, what the layman in the street will call obojo or short time. They have to do so because they got to survive. They're not doing it because they are willing to do it, but they're doing it because that's the only means they have to survive. And besides that, too, like I said, the family too also play a pivotal role when it comes to that. Bulk of the females, as a result of increasing level of divorce, you turn out that most often female will have to raise the children, and because of the female dating behavior, she have multiple sex partner coming in, and more besides, like due to poverty again, they will sleep in the same room. So if the child sees you performing that act, what normally happens is that what's all the child see people doing, they want to also practice that. Sometimes you notice in the community, yeah, children doing mama and papa play, because they are in the room at time, they are seeing some of these items or some of these things are being performed, so they do want to practicalize them. And when they do that, then they come up with teenage pregnancies. More to that, like I make mention on individual as well, because the individual too, because of what we call peer pressure, because of their friends, the friends they are with, they are sexually active. So because of that, sometimes some friends turn to sway them into getting involved with sexual practices. As such, it lead them to coming down with teenage pregnancy.
Thank you very much. And you said up, I think our listeners are there, they are listening to you, and you are making a great impact, especially you pinpoint key things, especially parental care. If you have poor parental care, definitely that child will actually suffer it.
Sure.
And force in marriage also too. You discuss that.
That's one of the things as well, because our culture, I don't necessarily mean to denigrate people cultural practice, no, but because in Africa or in Liberia, for example, many young females are forced into early marriages. So and there are some cultural practices that they have to do. So if you get involved with early marriage, what your married people have to do, it means that you have to practice that. So because if a 15-year-old girl will have to get married, trust me, she will have to get involved with sexual activities, and subsequently she will have a teenage pregnancy as well.
Thank you very much. And also too, we have low supervision, especially parent. If you are not supervising your children the right way, and they are on phone, how the phone looking like, what they are watching, and the kind of friend, their association also too, it matters. Thank you lengthily for that. Now, are there any courses?
Yes, there are several other courses that will lead to teenage pregnancy. To name few, like I said, according to the UNFPA report of 2020, they said what further exacerbate females or teens coming down with teenage pregnancy. One, it has to do with gender-based violence, rape cases. Of recent, rape are almost like a day-to-day activity in our country that some civil society organizations had to go and protest against them. And maybe quite recently, at least, we have witnessing maybe a tremendous drawdown of rape cases because of Liberia being a country from post-war, 14 years of civil conflict or civil unrest. So many a time, people get involved with violence. Violence will lead to some level of rape cases. As such, it might lead to unwanted pregnancies. Besides that, people who are involved with illicit drug use, people on the street, the people we normally call zogos, because of their affiliation at times, they get involved with sexual activity, and subsequently it will lead to them coming down with a teenage pregnancy. again, like I said previously, young people again, because they have to survive, so people tend to involve with, when especially the females will get involved with commercial sex. So people having sex for money, and they have some negative implication, and teenage pregnancy is just one. It's just one of the implications. There are several other factors for which, some psychological impact it might have. You might come down on some level of STDs or STIs, but teenage pregnancy too also is one of the key factor too, as it relates to that activity. And one of the key thing again, because of poor access or limited access to information, like I said, discussing sexual information to people even at the grade school level, at the tertiary level, is like a taboo. You even go at the tertiary level where in quote unquote you have several adults there, people don't want to discuss things that has to do with sex. And because people do not know the implications of having sex maybe during your teen age, automatically they just get involved. Because they get involved now, then they tend to come down with
Thank you
teen
very
pregnancy.
much
These are
for that.
factors.
Thank you very much. You said that, and I think our viewers are watching, and we have an expert, we have a youth, former student leader. He has an organization and working along with it. So, and another thing again, you discuss all, and it's true. And we talk about poverty, we talk about cultural, what people facing, and people in marriage and other things. Especially these are causes. Now, you have an organization. You've been working with a student. What is your take? What is your reaction? How is their view when it comes to teenage pregnancy? Are they receptive, or they still innocent it?
What happened is like somebody told me before, if you read the change theory, you understand that people are resistant to change. So it's actually a gradual process. We continue to talk to them, we continue to talk to young people to get involved with safe sex practices, to discuss family planning with them, to discuss some of the negative implication if they don't have safe sex. And some of them, to be honest, like it used to be like before, that people were not even waiting to sit and talk. At least people now, they are kind of encouraged to listen to some of these things so as to make positive impact in their community. But to be honest with you, the work, we need to do more work. We need to do more work and get involved with activity like this to discuss these things on platform like this, so that the broader society can be able to get understanding as it relates to sexual activity, and subsequently that may lead to quote unquote teenage pregnancy.
Thank you very much for that. And our viewers or Facebook listeners and those in Radio Land, pretty soon we'll be opening our line. What are some of the complications? Are there any complications of teenage pregnancy you know of?
Because that's one of the main things. This is why we don't want people getting teenage pregnancy. Not necessarily because we just don't want people born in no, but because of the complications that are involved. And these complications, bulk of them, they are life threatening, and sometimes it will even hinder one from achieving his or her goal. And also, these complications are not only limited to medical, but economically too, they have some negative impact on society, and some of which include, like in Liberia now, if you look at the maternal mortality rate, is very, very high in Liberia. And the reason why this thing is very high, if you go to the statistics, you find bulk of these people, they are teenager. And because they are teenager, there is increase in level of maternal mortality, there is increasing level of infant mortality. Because a little girl who cannot even take care of herself properly, and you give her a whole human being to be able to take care of, is something that is laughable. It's almost impossible for her to do, because she herself, she's not even able to take care of herself. Then you telling her to take care of somebody. And besides that, the fundings too are not available, because like I said, poverty, and they don't have the technical know-how because of the limit of access to information as well. And also there is some level of STRs and STDs that are being gotten from there. Because if we look at pregnancy as a whole, we understand that before one give birth, there we have something in obstetrics and gynecology nursing called the 5 P's. So we have the power, we have the passenger, we have the side, we have the position, or what have you. But what am I driving at is that if you go to the passage, they say the passage should be adequate enough. And considering someone who is a teenager, scientifically in some cases, the passage is not adequate enough. As such, people die in childbirth. And then you go and look at some of the data that are coming, they are not actually encouraging. So this is why we're telling people not to get involved with sexual activity that may subsequently lead to teenage pregnancy.
Thank you very much. I think we are learning much here from you, Mr. Smoke. And to open the phone line, you can call 0770-107-107 or 0886-107-107. We will pick up your line and we'll listen to your contribution, your question, and your suggestion towards the platform. Yes, you discussed that, and another issue, because all of that surrounding a lead also to mental health condition. A lead up to mental health conditions.
Hello?
Yeah, hello?
Yeah, hello, this is calling from VOA.
Mercy, you're welcome on the platform.
Yeah, I would appreciate you guys to know, especially party. I feel very thankful for the education you are sending out to our young sisters out there. And I hope I've been listening and because of this advice. And I also want guys to share on the educated nation. Because I want to thank you.
Thank you very much, Mercy, and thank you for that. We are in a discussion, and I think our guest is here. He's prepared to do that. Thank you ever so much.
Okay, thank you.
You're welcome. Hello? Hello, the feedback. Hello? Yeah. Can you okay, sorry, please dress a little bit from the radio and you will get a clear. So the cell number is 0770-107-107. You can participate in 0886-107-107. You can share your view, your comment, and your questions that he is able to answer that. Hello? Can you call your name? You are coming low. Yeah, hello? I'm okay, and you? Okay, thank you very much. You are welcome on the show. Thank you ever so much for your contribution, and we have a guest is listening, and you actually make a salient point. Hello? Hello? You're welcome, your name? Okay, welcome.
Yeah, thanks to the speaker guest and thanks to the Prevalence. Very long topic of discussion. I just want to know that most of the courses are being expensive these days. For me, I think it's the foundation of the children. These days, parents are not really focusing on children, but the foundation has a very serious effect on them. And like what you were saying about sadly and OBGY, especially for the sadly, the mind of the mother, if you're not fundamental and now you go into a pregnancy or you go to give birth to delivery, it has a very serious effect because you'll be thinking now, what am I going to do? I'm not able to push the child. What am I going or place upon me? So these things is a very serious effect. And for me, I would recommend sex education in high school, especially for the third grade up to 12th grade, because it can really help the children to understand their life and how to prepare themselves for a better future. Because our system these days are really scoring, especially for what you said. And only all these children are going around now seeking for what they want because the parents cannot help them financially. So what they're doing now, they're going around the road, getting money, put themselves in sexual activity and their sport and full future. So I very much appreciate you guys for bringing this topic and I hope to be with you guys one day to discuss this.
Okay, thank you very much, and we hope to host you also too because you bring experience to the platform, and all of you people are very helpful in the discussion, bringing your various views. We appreciate that, and thank you very much. So, hello. Oh, okay. Thank you very much. Now we know what time we are going through, and we need to summarize in order for us to give our audience the time to call. We were talking about the complication associated with it, and are there any options, especially when these teenage pregnancy and when they are pregnant? Are there any options, or suggestions, or what to do because they are already in it?
Yeah, there are suggestions that can be made, but the problem is how effective would they be? Because the health sector in our country, in practical sense, they are experiencing some level of challenge. There's a serious challenge. So people or teen who is already pregnant will need serious medical attention, and they need somebody of experience that will be able to be with them, even a mental health clinician as well, because like one of the caller talk about some psychological effect it might have on the mother even after the delivery, because she will need some level of counseling to incorporate her back into society. Because mind you, there are several different forms of depression like postpartum blue, postpartum psychosis, or so forth. And these are some of the things too that may lead to the mother not getting back into on her feet, that she can make it. She can make it. And this is why I'm recommending that there should be increasing level of programs like this to create recreational activities for young people to get involved, most especially people that have already quote unquote made their mistakes and come down with or have teenage pregnancy. Like I was doing a research and I was finding out, looking at why those countries that there is increasing level of teenage pregnancy. And
Hello? Yeah, good morning, caller. Your name, where you calling from? Okay, you're welcome.
Thank you very much. You know, more especially grandchildren, not men parameters. Grandchildren going to contract UTI. UTI is very easy for me to contract it, and when you contract it, it will take long before they even discover it. The topomonium also involved with it. So, the mothers and the guardians, they should know how to control the grandchildren. Observe them. Sometimes, you know, you can be so if
Thank you ever so much for your education and your experience you also bring in the platform. I think it is encouraging and advice for the parent to actually take into consideration. So as we are discussing, let's just go over it, especially looking at the options. And some other options can be if you are pregnant, medically you have to visit your doctor or the midwife, and you people can discuss. And the medical abortion, they have options there. And another thing, again, you can talk about adoption. Probably you are pregnant and you know you're not able to carry and other thing, but in case you have the child, who you think adoption process also too can be discussed there. And the third one is about, you have to bring the child out, and how you think you bring the child out. Like while you are discussing, you need a mental health clinician also too, you need a good counselor. But you are doing this with consent with the man, and with consent with the family also too.
Sure.
To really look at that.
So that's why I was driving at. So in the research, and I found out that Liberia was to spot number 5. But other countries like Mozambique and Chad, like in Mozambique, what they were doing is that UNICEF created institution for men called the husband school, and men go there like 2 times in a month. Yeah, and the reason why they include men, because this is a 2 man's job. It's not only on the female, so male as well needs to be sensitized, and we should not forget to say we are only discussing with female on how to stay safe, how not to come down with teenage pregnancy, because they've been influenced by their male counterpart. So they created that institution, and then males go there and then they discuss on sexual activities, on how to keep your partner safe. And as I was reading, the interview a female, and she said since the establishment of that school, at least their male counterpart, they are somehow very caring for their wife, because they needs to be involved in process like this. So these are some of the options for which they can be able to use to be able to help in mitigating some of these negative impact of teenage pregnancy.
Yeah, thank you very much for that outside experience, and to see how our health sector also too can buy that out there in the clinic, in the hospital, to create proper awareness. Now, what about the preventive measure? We are educating our girls, and why preventive measure that people, probably those that are not in that teenage pregnancy, or they don't have it, and what the others can do. And even if you have it one time, well, what you think you can really do in order for you to prevent teenage pregnancy?
Okay, that's a good question. Teenage pregnancy, we can employ what we can use to be able to prevent STIs and STDs using the ABC technique. And we know A is almost impossible, but again, because they are teen, we can talk them through. And A say you should abstinence. So young people should abstain from sexual activities, and we could encourage them, because explaining the negative effect and the way in which the message can go across, unless we have programs like this wherein we got a listening audience and people are following. And besides that, based on the statistics you read, it says the percentage of female or teenage pregnancy in a rural area, they double that of the one in the urban area. So it means that more emphasis need to be placed on the rural area in providing sex education, so that young people or teens can be able to stay away from sexual activity. That's one. And 2 says, which is B, it says you should be serious. So being serious as a teen, you want to achieve your goal, you want to go to school. Some of them will say, I want to be a medical doctor, a nurse, I want to be a pilot, or what have you. And you encouraging them that you can only achieve that if you not get involved with sexual activity, and subsequently that may lead you to teenage pregnancy. So if you be serious by avoiding some of these things, automatically it will mitigate you, or it will limit your chances of coming down with teenage pregnancy. And C, which is the last one, it said we should use condom. So we could use condom, we could use some level of contraceptive, because condom is one form of contraceptive stuff. We can use some IUDs, intrauterine devices, to be able to help curtail the spread of or to be able to help or reduce young people or teens from coming down with pregnancy that may subsequently lead to some complication that I discussed earlier.
Thank you all so much for that education, especially when it comes to the prevention of teen-age pregnancy. And like you were talking about the contraceptives, we have different mentors. Can you really educate some our youth, our parents, the very mentor of contraceptives that they can do if they cannot esteem, but esteeming is our best practice.
Sure.
From it, but
Sure.
it is
It's
that
more safer
difficult
as well.
because we, especially the society that we are in. So what are some other
Exposed.
family
Yeah.
planning mentors that we can use?
So one way, like I said before, if there is a positive discussion with the mother and the offspring, most especially when it comes to sexual activities, so that teen can be able to monitor her ovulation period if she does that properly, and she will know her safe time to be able to have sex without coming down with pregnancy. And besides that, we have oral contraceptive as well, like Macrogenium, Macrolu, and they have time duration for which you can be able to take these contraceptive for. So you can be able to do that, and subsequently, at least you can be safe from coming down with teenage pregnancy or use condom during sexual intercourse.
Yeah, hello. You are welcome to Mamawa Loma Health platform. So your name?
My name is Christian Williams, and I want to say thank you for the show. Let me say a big thank you to your guest, Mr. Sumo. I've been following closely, and I just have to make a brief contribution. You see, the issue of teenage pregnancy is something that is alarming our country nowadays. So, Patty earlier mentioned that we are young people, especially in the young profession, we need to do more. And I think we agree with that statement. In fact, for us to do more with impact, I want us to get these young people involved. Let's get into the heights, educate them, come up with a club that they themselves will be part of the process to get out there and be a change agent, get their friends about what they are learning. I see, since we have the education of what it means to control yourself, because these young people do not have the idea. But when you teach a young person about their menstrual cycle and they know how to take care of themselves, because it's completely, let's say, people cannot avoid the issue of accident. But when they know that cycle, I think it's definitely one of the help them. So these are some of the things we want to do. Get the young people involved in the process, and that is your change agent. So just conclude. There is this new area in my community who looking at our parent commission and Mr. Buffet. But parents cannot hear their full right. But she goes to school and comes in very late. I mean, when all the parents have tried to beat on the child, talk to the child, people come to say, do not beat on the child. Beating can no longer help. We will talk to the child. I mean, there is all measure. But yet still, the child is still going out and repeat every kind of thing. And in the end, just recently she was checked and now she's pregnant. Now she's starting and she was going to regret what is happening to her. So when we get those sort of people involved, right, when in the end step to get out there and educate that friend that the mistake that I'm still having, please not make that mistake. I mean, it's very motivational and it will inspire someone that needs to think and try to stay away to not get involved in his pregnancy. Thank you very much for putting me in time. I'd like to say kudos back and consider the process.
Okay, thank you. I think I have a question for you. Thank you for the discussion, the contribution. So what are you doing? What are you doing in your community? Oh, okay. Thank you. Thank you very much. So you have to do well in your community. Everyone that is contributing, you need to do well in the community. If you can get someone you are discussing with them, and we should start our own self in the community.
Definitely.
While we are in a car.
Sure.
We should take that self initiative in order for us to educate, because Liberia is the only one that we have.
Sure.
Especially looking at the statistics, there are high increase in teenage pregnancy, especially in Liberia and Africa. How do you think we can meet up with it? It is ourselves, especially the color. Most of them, are informed, but your information should not be to yourself. You have to disseminate that information
Definitely.
to your community, your household, and what we are doing. Hello, hello.
Hello, good afternoon.
Yeah, who am I speaking with?
You're speaking with Grace. I'm calling from Jacobstown.
Yeah, welcome. Your contribution, your questions.
Yeah, I want to say something on the teenage pregnancy, and which I'm very grateful for to hear on the radio this afternoon.
Thank you.
The rate of the teenage pregnancy is getting so high in Liberia, our community, and the environment. And I think from my own observation, it's due to peer group pressure, the poverty rate, and lack of understanding when it comes to this kind of something. Because you found the children here and there having unprotected sex, which definitely causes pregnancy. And then you found your friend doing this, you also want to do it because your friend is doing it, you feel it's fun. When you go there, you find yourself involved in it, and then you get pregnant. So we as a community people, we need to stand up together to fight against this thing, advise the children, talk to them, put them together on talk shows, and make them know that it is bad for them having child still in school.
Grace, thank you very much for that salient point, and you actually make a day, by contributing. I know that you are doing something like that in your community.
Definitely.
Okay, so you are welcome.
Thank you.
Thank you.
Bye.
Yeah. So we are running out of time. Our honorable guest, and like what we're discussing, you have the 5 years, and then
Yes.
yeah, people the 5 years, and you have a lamb. Like why you talk about the normal menstrual cycle and other things, you can educate. It's just based on education. When we are educating our girls, we're educating the boys, and parental. Hello, caller. Your name and where you calling from? Yeah, welcome. Thank you very much.
Thank you so much.
Thank you very much for your brilliant, education. So now we just have a limited time. We know we have so many colors today. So 30 seconds, please, just summarize.
Okay. Yep. So thank you, and first let me appreciate you for having me on this platform, and to the Halavan family as well, at least for providing us the opportunity to be able to discuss pertinent national issues like this that are affecting our society. And to the main listeners up there, I will ask that, because considering that this is like a pandemic or an endemic that is squarely associated with Liberia, or is an epidemic or an outbreak of a particular condition, so we should be able to spread the necessary information that we are spreading the cue. So by spreading the information to the requisite people, automatically we'll be able to mitigate some of these things. So thank you, and thank you ever so much.
Thank you ever so much, Mr. Bassey Smooth, for that brilliant, talk show that we have this morning, and also thank to our station manager. So we still be listening to Mama Lomet Health Talk platform. Next week, Thursday, the same time, we'll be having this splendid talk. So we discuss about teenage pregnancy. We know how it is prevalence, and what are the contributing factors. We discuss all that and other quarters. So to our parents, please, we need to do the preventive method. We have to take family planning. Abstinence is one of the great. So my name is Dixon Kofev for today's host. So thank you very much. Thank you to the DJ Blue family and Mama Lome for giving me the time to section this time. Thank you.